This video is going to inform the dental and dental hygiene student about ergonomic positioning for patient care. It is imperative that the dental healthcare professional be mindful with their posture as to thwart off potential musculoskeletal disorders before they occur. Let's begin with a definition. Ergonomics is the science that is concerned with the fit between people, technological tools, and the environment. It focuses on making daily tasks comfortable and efficient and reducing bodily harm. The science of ergonomics is important for the worker comfort, productivity, and workplace safety. For dental health care providers, the work environment includes the office layout, the dental equipment, and dental instruments. If poor ergonomics are followed, the dental health care provider can suffer from many musculoskeletal disorders, such as rotator cuff tendinitis, extensor wad strain, carpal tunnel, ulnar nerve entrapment, and tendinitis, to name a few. Many of these disorders are caused from poor positioning of the wrist, forceful or awkward movements, poor posture, and repetitive movements. Therefore, before you begin treatment, you want to think about the following things. How am I sitting? How is my back and neck? Where is my equipment? Is it too high? Where is my light? Where is my patient's body? And where is my patient's head? Let's start with the correct neutral position for the clinician. Avoid tilting the head too far forward or to one side. Avoid having a curved back. You want to avoid leaning or twisting at the torso, making sure that the spine is always straight. Avoid hunching the shoulders up to the ears, having the elbows held above the waist. Keep an angle of less than 60 degrees between the forearm and the upper arm, and avoid keeping the palm too parallel with the floor. You should sit with your back to the chair and your sit bones slightly elevated so that your thighs are fairly parallel to the floor. The patient should be low and supine, and the patient's feet are even or slightly higher than the tip of their nose, and their head is even with the upper edge of the headrest. The chair back is nearly parallel to the floor for maxillary treatment and slightly elevated for mandibular treatment. Their head should be near your navel. The proper positioning of patient care ensures that you have the proper vision to see what you are doing while maintaining a neutral spine, neck, and wrist. Always make sure to have the correct lighting. Let's watch the student and instructor work together before patient care. First, the student is adjusting the chair so that her thighs are mostly parallel to the floor, yet her feet are flat on the floor. Next, she will adjust the patient's chair height for correct positioning. Notice that this can take several tries to get this exactly right. The patient here is too high, as the clinician's shoulders and arms are not in a neutral position. You want to avoid having an angle between your upper arms and forearms of less than 60 degrees. She will need to lower the patient so that her head is closer to the clinician's navel. Once the patient is at the correct height, it is important for the clinician to think about her posture, making sure her torso is in line with her long axis and that her shoulders are even and not hunched up to the ears, that her neck is in neutral position and not tipped too far forward or to one side, and that she avoids a curved back. One common mistake that clinicians often make is having a chicken wing, where the elbows are above the waist level. It is important to keep the elbows at waist level to maintain a neutral upper arm position. Another common mistake that clinicians often make is they tilt their head in one direction. This should be avoided in an attempt to maintain a neutral neck position. Now let's watch the faculty adjust her body and the patient's positioning for proper ergonomics. Another way to double check to see if the patient is at the right height is to sit beside the patient and have the patient's mouth below the point of your elbow. Let's watch the student one more time without her instructor. begin learning about our seating positions, there are a few things we need to learn. During patient care, it is important for you to instruct the patient in which way they should move their head in order for you to have the best possible visualization. Let's begin by having the patient in a neutral position. It is best to ask the patient to make their head straight. Next, you will see the patient turn away. It is best to lightly guide the patient and ask them to turn away from you. Guiding the patient to turn towards you for surfaces that are further away from you will help with maintaining a neutral body position. Finally, sometimes it is necessary to have the patient turn neutral but drop the chin down to their chest. Often the clinician will need to guide the chin in the right direction. Now we must determine our toward and away surfaces of the teeth. When sitting directly at 9 o'clock for right-handed clinicians or 3 o'clock for left-handed clinicians, you can easily determine what surfaces are considered your near or toward surfaces and what surfaces are considered your far or away surfaces. When sitting at this position, the home position, all surfaces that are close to you are your near or toward surfaces, and those that are further away from you are your far and away surfaces. In the posterior, the surfaces are divided up facially and lingually. In the anterior teeth, the teeth are split in half down the midline. Typically, when working in a near surface, the patient's head will be away from you. When working in a far surface, the patient's head will be towards you. Or let's orient ourselves with the clock positions. The spot directly above the patient's head is 12 o'clock, and at the patient's feet is 6 o'clock. Right-handed clinicians will work from 8 to noon, and left-handed clinicians will work from 12 to 4. Let's go through the seating positions. 8 o'clock or side position. This can be referred to as home. The alternate spot would be 9 o'clock. You will next see the clinician move upwards into a 10:30 seating position. The navel of the clinician is near the patient's ear. The next seating position is a range between 10 and 11 o'clock. This position allows the patient to have a neutral neck and the clinician to have good visual. Finally, the next position is between 11 and 11:30, moving upwards to a 12 o'clock or start position. This position is where we often start and end our day, making sure that our patient is in the correct position. Let's look at the left-handed clinician seating positions. 4 o'clock or side position with an alternate of a 3 o'clock position. Both of these positions can be called home. In the 3 o'clock position, the legs straddle the chair. The next position is 2:30. Your navel is near the patient's ear. The next position is 1:30 to 2 o'clock position. Moving upward, we now come to the 1 to 1:30 position. And finally, the 12:30 to 1 position and 12 o'clock or start position. Follow along in the instrumentation manual. Most of the positions will be used for all instrumentation. Let's begin with the right-handed clinician. Maxillary right buccal. There is no mirror fulcrum, but we retract the cheek with the mirror. The patient is turned slightly away with the chin up. The clinician is sitting at a 10:30 position. Remember, for maxillary instrumentation, the light is at an angle overhead. Maxillary anterior facials, there is no mirror fulcrum. The lips are retracted with the fingers, and the mirror is in a palm grasp. The patient's head is in neutral position with their chin and neck in a level position. The clinician will sit between the 11:30 and 12 o'clock seating position. Maxillary left buccal. Again, no mirror fulcrum. You will retract the cheek with the mirror. The patient's head is towards you with their chin elevated. The clinician will sit between 10 and 10:30. This is an indirect vision, and you will need to turn the mirror so that you can visualize the buccal surfaces of the posterior teeth. Maxillary right lingual. The mirror fulcrum will be on the premolars of the left. Use the mirror to see the lingual surfaces. The patient's head is towards you and the chin is up. The clinician will sit between the 10:30 and 11:30 position. Maxillary anterior lingual. The mirror fulcrum is on the left premolars. The patient is in neutral and their chin is elevated up. The clinician will sit between 11:30 and 12. You will need to use the mirror to see the lingual surfaces. Maxillary left lingual. The mirror fulcrum is on the right premolars. The patient head is away from you with the chin elevated. This is an option spot, so therefore the clinician may sit at either the side position or the 9 o'clock position. This is a direct vision, and you will use the mirror to help retract and reflect light into the dark spaces of the lingual posterior teeth. Remember to move the light directly overhead when treating the mandibular arch. Mandibular right buccal. No mirror fulcrum, but you will retract the cheek with the mirror. The patient is in a neutral position and may be slightly away. This is another option spot. The clinician can sit at 8 o'clock side position or 9 o'clock option. Mandibular anterior facial surfaces towards. No mirror fulcrum. Palm grasp the mirror while retracting the lips with the fingers. The patient's head is in neutral with the chin lowered to the chest, and the clinician will sit at the 8 o'clock or side position. Mandibular anterior surfaces away. You will palm grasp the mirror, retract the lips with the fingers. The patient's head is neutral but chin down, and the clinician will sit between 11:30 and 12. Mandibular left buccal. Again, no mirror fulcrum, but will retract the cheek with the mirror. The patient's head is turned towards you. The clinician will sit between 10 and 11. However, you may find that you have to sit closer to 11 to access the mesial and 10:30 to access the distal surfaces. Find the seating area that allows your wrist to maintain a neutral position. Mandibular right lingual. The mirror fulcrum is on the maxillary left premolars. Retract the tongue and provide extra light. The patient's head is turned very towards you, and you'll be sitting between 11 and 11:30. Mandibular anterior lingual surfaces away. The mirror fulcrum is on the left premolars. Here you must use indirect vision, and you will use some reflection of the light from the mirror for illumination. The patient's head is in neutral position and their chin is down. The seating position is between 11:30 and 12. Mandibular anterior lingual surfaces towards. The mirror fulcrum is on the right premolars. The patient's head is in a neutral position and their chin down. The clinician will sit at the 8 o'clock or side position. Mandibular left lingual. The mirror fulcrum is on the right premolars. You will retract the tongue in addition to using the light from the mirror for reflection. The patient's head is turned away, and this is another option spot. The clinician can sit at the side position or at 9 o'clock. Now let's review the seating positions for the left-handed clinician. Let's begin with the maxillary left buccal. There is not a mirror fulcrum, but you will retract the cheek with the mirror. The patient is turned slightly away with the chin elevated. The seating position is between 1 and 1:30. Maxillary anterior facial. The lips will be retracted with your fingers as the mirror is in a palm grasp. The patient will be in a neutral position with the chin level to the floor. The clinician will sit between 12 and 12:30. Maxillary right buccal. There is not a mirror fulcrum, but you will retract the cheek with the mirror. The patient's head is towards you with their chin elevated. The clinician will sit between 1 and 2. However, when assessing the mesial surfaces, you may need to sit closer to 1, and when assessing the distal surfaces, adjust towards 2. Maxillary right lingual. The mirror fulcrum is on the left premolars. The patient is turned away from you with the chin elevated. This is an option spot. The clinician can sit at 4 o'clock or straddle the chair sitting at a 3 o'clock position. Maxillary anterior lingual. The mirror fulcrum is on the left premolars. The patient's head is in neutral with their chin elevated. The clinician will sit between 12 and 12:30. Maxillary left lingual. The mirror fulcrum is in the right premolars. The patient's head is towards you with the chin elevated. The clinician will sit between 1 and 1:30. Let's move to the mandibular arch. Remember to move the light directly overhead. Mandibular left buccal. There is no mirror fulcrum, but retract the cheek with the mirror. The patient's head will be in the neutral position or maybe slightly away. This area is an option spot for the clinician, as he and she can sit at side position or straddle the chair at the 3 o'clock position. Mandibular anterior facial surfaces away. You will palm grasp the mirror and retract the lips with the fingers. The patient's head is in neutral, but the chin is down. The seating position is between 12 and 12:30. Mandibular anterior facial surfaces towards. Retract the lip with the fingers. Patient's head is in neutral with the chin down, and the clinician is sitting at side position. Mandibular right buccal. The cheek will be retracted with the mirror. Your patient's head is turned towards you. The clinician will sit between 1 and 2. However, when assessing the mesial surfaces, you may need to sit closer to 1, and to assess the distal surfaces, you may need to adjust towards 2. This will help to maintain a neutral wrist. Mandibular right lingual. Mirror fulcrum on the maxillary left premolars. The mirror will be used to gently retract the tongue and to add light. The patient's head will be turned away and the chin elevated. This is an option spot, as the clinician may sit at the 4 o'clock or at the side position. Mandibular anterior lingual surfaces away. The mirror fulcrum is on the right premolars. Indirect vision must be used. The patient's head is in neutral and the chin is down. Oftentimes the chair back is slightly elevated. The seating position is between 12 and 12:30. For the mandibular anterior lingual surfaces towards, the mirror fulcrum is on the left premolars, and the patient's head is in neutral with the chin down. The clinician will sit at 4 o'clock. Mandibular left lingual, the mirror fulcrum is on the maxillary right premolars and will lightly retract the tongue. The patient's head is turned very towards you. The clinician will sit between 1 and 2. It is important, as dentists and dental hygienists, that we constantly reevaluate our patient positioning and our own personal ergonomics so that we may practice for a lifetime.